would move it away.
Good. Move it away. Now, one thing, was your hand doing something at this point? Possibly.
Yeah.
So what's another thing we should do when we see contamination? Call it out. All right, contamination. I need to go ahead and remove this contamination. Even if it's the surgeon, guys, surgeons will accidentally touch something, serve you, contaminate your hand. Can you take that out of here? Let's go ahead and fix that situation right now. My glove has a hole in it, okay? Try to pull away, but also if you're doing something important, you can't just let go of a retractor. You can't just let go of a clamp. You can't just pull away because you're doing something important. So you must call it out. Sir, ma'am, doctor, I'm contaminated. Where? My hand, can I pull away? Sure. He's either gonna say, let me grab it, let it go, or wait. 1 second. Wait, if it's not a direct contamination to the patient, you could wait. But as soon as you can, you need to isolate. Contaminated. Nurse, take it, isolate. There's no nurse around. Put it on the corner of your back table, away, isolate. So whatever you have, try to isolate, okay? So in this case, let's say his glove is contaminated. Okay, so he's gonna isolate, go ahead and do the whole spiel.
Oh, I've contaminated?
Okay, good. So most of the time, people are just gonna be like, okay, let's continue. They're not gonna get scared. Okay, if you're not doing it right, okay, but if you say contaminated, trust me, they love it when you guys say something like that. How many times the students got scared and they're like, as soon as I say contaminated, everyone's like, good job. That's what they want to see, that you guys are aware of contamination. It's like we do with your finals, right? You want to make sure that you're aware of your contamination. You found it and you're able to continue, because if we take you out, there's nobody there to help that patient. So you need to be able to catch these things and continue fixing these contaminations so we can continue to be sterile, okay? So in this case, you need to isolate that, and now you need to get that sterile again, right? Anybody have any ideas what you might need to do? ReGlove is a good one, right? And we are going to ReGlove. Now, are you going to be able to ReGlove the way you did when you first started? No. It's a totally different ballgame. That's where we're going to use the open glove technique. Okay? First of all, we're going to show you guys how to take out the glove. Ivan, can you please? You're now the nurse, right? The nurse is going to go over there. So you already called it out. Okay, and again, the situation here is not a true OR right now. Right? So let's pretend. Your nurse is going to go ahead and go over to the hand or glove. You're going to present your glove to the nurse, palm up. Okay? So hold on with it. Palm up, right? And make sure, guys, you're just bring it down to your nurse. Your nurse is taller, bring it back into the nurse. What your nurse is going to do is grab the glove at the palm where the cuff is. They're literally going to try to pinch the cuff and glove so that as they pull it off, you also go ahead and retract your hand back. The whole point of this is that so your cuff can go beyond your hand, as if you were when you first started scrubbing. What are you going to do? Is that area also contaminated? The cuff is contaminated. We're not talking to you guys that cuff is considered contaminated. Is this now considered, or is it a true contamination?
Considered.
Your cuff, your hand went through, so it's actually contaminated. So you isolate it. Just go ahead and bunch it up like you did when you first started, right? Bunch it up, get it all isolated so that it's not around. Alright, now your surgeon says, go ahead and go ReGlove. I got this part. You let go of the retractor, I got it. Now you need to go apply the other glove. Okay? Here's where the open glove thing. So, Miranda, I think you guys got that. You want to show them? Alright, so what are you going to do, guys? Either your nurse is going to open up gloves to you, just like you guys know the peel pack. They open it, what do you do? If both your hands were contaminated for some reason, your nurse will also take off your gloves the same way. Or both. Now you can't do anything, right? So, if one hand is sterile, then just grab the package and then throw it onto your field. And then you're going to do what the techs are doing next, right? You're going to gather around. Over here, you're going to do the full open glove. Again, Again, open glove technique, guys, is a little different. Ivan, do you have gloves too, or? No? So, and we'll let you guys go around and they can show you too. But open glove technique, guys, you're applying these gloves knowing that you are contaminated or knowing that you're not surgically clean. Okay? Yeah, we'll pretend that she has, just like Elliot, we'll pretend that her left hand is contaminated and her right hand is sterile. Okay? The best way is to reach inside the sterile cuff. Okay? Because can sterile touch sterile? Yes. So just go ahead and pull off. During open glove techniques, pull your glove off of the actual package. Don't let it slide. She's got to make sure the fingers are facing downwards. And she's going to do is kind of cup her fingers together, pinch together, and then you're going to kind of slide and wiggle your hands through there. And it's just that easy, guys. Making sure that you continue to cup. Remember, every time you're applying sterile drape, sterile stuff, you always have a cup. So make sure you're inverted. That's why we went inside the cup, to continue to be inverted, to not drag contamination. We always invert. Just like when you guys do this, you're doing the same thing with the gloves. You're inverted so you can put on that glove. Okay? Now, if both their hands are contaminated, you want to come in and show the home place? The open glove technique, do you remember?
Pinch it.
Yep. Alright. So what you're going to do, let's say both your hands are contaminated. You're not going to be able to do this on the sterile field. You're going to have to open your gloves carefully on a non-sterile object, guys. Okay? So as he did now, he just opened, but as you're non-sterile, you got to make sure not to touch the inside. Because now, if Elliot had both his hands contaminated, remember, he's just working with pretty much like a puppet. He doesn't have his fingers, so he's not able to grab that as he should. He's going to have to contaminate. As best as you can, you're going to let both hands out as best as you can so that you can grab this in a non-sterile fashion. And that's why it's an open glove technique. Who else does this is nurses. Nurses apply the open glove technique to prep, to hold something like a leg. Maybe they need help holding a retractor even, okay, for at least a couple seconds. Anytime you're doing a quick procedure, sometimes ENT doctors like to do the open glove technique so that they don't have to scrub in, because guess what? The mouth is dirty. But they should do it sterilely still, because even though the mouth is dirty, it's that patient's dirty mouth, not yours, not the field's, not all the germs that are around. We do not put on regular gloves to work. It's, how would you guys like it if people just put their gloves and fingers into your mouth? You don't know where those hands are been, so we must use sterility at all times. So in this case, how do you do it if your hands are not sterile? Then what you want to do is grab it at the most non-sterile part. In this case, be the cuff. The cuff closest to the opening. So go ahead, grab the cuff closest to the opening. You see, he grabbed the cuff where it's going to become unsterile anyway. And the same technique she used, but now he's in the dirty side compared to she was in the clean side. You're going to apply this fingers facing downwards and shimmy your hands as best as you can without pulling the entire cuff. So don't pull the cuff yet. Okay. Without pulling that. So now as you see, if you were wearing sterility, if you were wearing a gown, then that'd be bunched up in the wrong spot. So what you want to do as you pull, shimmy so that you don't pull it and it uncuffs. Because if that happens, just like it happens here, it kind of curls up. So you want to leave it. So go ahead and just pull it back like if you were cuff. Back on cuff. Pull it back like if you were cuff. The other way. So pull it back over, yeah. Just pull it back over. Grab this. Back up. Pull it back over. Okay. So you should end up with something like that. Okay? You don't want to finish. Okay? So, pull it back again. So don't overdo, don't overextend your hand, because it's going to roll off. Okay? Again, that's what I'm saying. All you do when you're pulling it is you shimmy back and forth and let it sit. Don't do this. Don't open your hand. Just keep it right there. Next, it might unfold. Next, now that that's sterile, now you can do again what Miranda did. So go ahead and reach inside the sterile portion of the cuff. Don't worry, it rolls it. Again, you're noticing he's not going to put his thumb there. You notice he's trying to get his thumb out this way because if he starts putting his thumb there, is there a chance he can contaminate while doing this? So he gets his thumb out the way, and again faces down and does the same thing. Get all your fingers together, slide them inside of that hole, and shimmy your hand in there. Now he can pull the cuff all the way if he wants to. Okay. Now with that other hand, he can fix that other cuff if it was still there. Okay. And that way now you apply those open glove technique. The reason I didn't show you guys to begin with, this is super easy once you guys get used to it. And if you don't do it at an expert level, you're going to contaminate. Okay, especially when you're already still gloved. If you slip for some reason, you end up contaminating your sleeve. So that's why we don't do open glove techniques. We, as surgical techs, will do closed glove. Me, as an expert, I do a little bit of a hybrid closed/open glove technique. Which again, I don't show you guys here because that's something that you do out there. Okay? So, if you guys want to see it, let me know when you guys are a little better at closed glove technique. Okay, so you guys want to see it. All right, yes.
Good question. So when you initially put in the first glove, you're supposed to not roll it all the way up? Okay.
No, because what you want to do is, again, remember that's kind of non-sterile and you're wearing a gown. So if he was a nurse and he did that, he's fine with it, he doesn't have a gown. But the thing I'm saying is leave that cup, because if you were wearing a gown and this uncurls, now all this becomes unsterile because your fingers were here. Right? So what you want to do is leave it there so that then you can overprotect that contaminated spot. So again, if you go here, right, this is all contaminated because my fingers are here. And if I left that cup, when I'm sterile now, I can protect it even further because now my contamination is here. If this just all rolled and it's there, I can't go up anymore because now I'm bringing contamination to the rest. Okay? That's what I'm saying. You got to understand what you're doing with that closed glove. Okay? All right. So what we're gonna do, guys, we're gonna continue to practice this. Okay? There's gonna be stations now that I want you guys to get. So when you guys return as students are doing stuff, come gather around with one of these guys, me, and we'll practice this closed glove technique all together. Okay? So that way, students are still getting the runs. Those of you guys that sometimes say, I don't know what to do, now it's time where we do this, and we'll start bringing out prep. So we can start prepping and circulating. Okay. Again, isolate, isolate, isolate. Anything contaminates, cover it or just totally take it off your field. And give the contaminated thing to the person. Don't do vice versa and actually grab the contaminated part, because now you become contaminated. And you keep going. So, again, isolate as much as you guys can. Questions? Comments? Good job, man. Good job, man. Good job, man. Good job.